In multiple myeloma, there's essentially three types of disease. There's diffuse infiltration of the bone marrow, which we're all familiar with, as well as osteolytic lesions and plasmacytomas, often which are extramedullary. And so we wanted to see if the microenvironment in the three different areas, regions, were different. So we're going to combine osteolytic lesions and plasmacytomas and call them focal lesions. And we found that in the focal lesions, there were very different neutrophils, as well as T cells and NK cells. We're working on the T cells and NK cells presently, but this is our neutrophil analysis. And my colleague Hemin Mohammedpour, who worked in the laboratory, along with Dr. Jens Hillengas, have developed the system to biopsy both areas and then look at the differences. So what Hemin found in the tumor microenvironment was that there were a tremendous number of aberrant neutrophils that you don't see in even the bone marrow of a multiple myeloma patient, as well as the bone marrow of a healthy person. So we compared then healthy donor bone marrow to random marrow to the osteolytic or focal lesions. And we found that there were two major populations in particular that express a tremendous amount of inflammatory cytokines as well as immunosuppressive cytokines. And these are tremendously immunomodulatory in that in vitro we found that these neutrophils would suppress T cell activation. So we think this has something to do with the immunosuppression that accompanies multiple myeloma.